The argument goes like this. Courts are poorly equipped to make decisions on the allocation of public funds, and decisions like that on the redistribution of state resources for health or education or housing or so on should be left to the legislative process, where citizens can engage in debates and reach the necessary compromises. The idea is, according to these commentators, that when courts get in the mix, bad results can happen. So, Colm O'Cinneide, what do you think about this? Is the right to health dangerous?
That's a big one. It's fun, isn't it? I think it's an interesting question. Is the right to health dangerous? Let me say, there are some grounds for being careful about what we talk about. When we talk about there is a right to health, and I think virtually everyone in this room thinks there is a right to health and that there should be a right to health, otherwise you probably all wouldn't be here. I do think we need to recognize certain complexities. I think there may be situations where if you start talking about a right to health, you'll get an answer back that goes, right, fine, you're talking about a right to health. That's wonderful in the abstract. But what does that mean for particular individuals within particular countries? And you will often get if you start campaigning on the grounds that the state has breached someone's right to health, you'll often get the answer back, well, healthcare and providing healthcare is an incredibly complicated, complex thing. And the answer will often be made when you start complaining about a violation of the right to health. The answer that will come right back at you is that this isn't something that courts can deal with. It's not something that lawyers can deal with. It's something that's not particularly suitable for an individual human rights analysis. This thinking is very deeply embedded. Lots of countries assume this automatically. South Africa is very unusual in having constitutionally enforceable socioeconomic rights. Many politicians, in fact, almost every politician I can think of, thinks that the right to healthcare, the right to health should be something they decide. So if you start talking about the right to healthcare, you will have people who will tell you it is dangerous to be talking about the right to healthcare, a right to health. I personally don't think the right to health is a dangerous concept. In fact, I think it's an essential concept. And because if you don't think of something like healthcare in terms of rights, you start thinking about health and healthcare in a very utilitarian manner. You start thinking about it in terms of, well, we only have so much money, time is precious, healthcare decisions can be precious, we don't like prisoners, we don't like drug addicts, women have strange problems. There are easier things to spend our money on. There are more clear-cut priorities. Our bureaucratic imperatives will take over. That's why I think it's absolutely essential to start thinking of health in terms of rights, because otherwise it's very easy for it to become a matter of bureaucratic, utilitarian thinking.
But don't you think that some arguments of cost-effectiveness or shouldn't the state have the right to decide on the optimal use of limited resources, and especially in poor countries? So how do you deal with that?
Well, I mean, this is the big question, because I've just said I support the notion of the right to health. I think it's hugely important. However, there are complicated decisions that often states and elected politicians are going to be the people who have to make. They're going to be the people who have to make the decisions. You often hear NGOs saying, well, you should be spending more money on your healthcare system. I think, personally, I think that's true. But turning that into a legal demand can be complex and difficult. I don't think it's impossible, but I think it can be complex and difficult. The UK has a free universal healthcare system. it's running a bit thin. It doesn't perform as well as some of the other European healthcare systems. The United Kingdom government recently pumped a huge amount of new money into the healthcare system and managed to bankrupt many of the healthcare authorities. It was an astonishing lesson in how complicated healthcare decisions can be. They put in hundreds of millions of pounds sterling, hundreds of millions of dollars, and they ended up bankrupting many healthcare trusts because of complex moving money around. So there are certain big decisions. There are certain decisions about how to structure funding, how money should be moved around within the system. There are certain decisions that you need economists, you need sociologists, you need elected politicians, you need civil servants, and legal and judicial processes aren't very good for that sort of decision. But there are other types of decisions that I think you can say, this is something a legal system can take care of, that this is something that a right to health care enforced by courts and judges, that this is a problem that can be dealt with through that form of thinking.